Should occupational therapists be allowed to be accredited within ACVREP and start teaching orientation and mobility? Or are they just going to come and take over all of our jobs, leaving us completely destitute? That is exactly what we're going to dive into today. And let me tell you, friends, the tea is hot, so you definitely want to stick around. Hi, I'm Cassie Maloney. I've been an orientation and mobility specialist for over 17 years now, and I'm the founder of Allied Independence, the Society of Exceptional Educators. And listen, there is a lot of strife going on within the world of orientation and mobility. Now, if you don't know what this world is, orientation and mobility specialists teach people with visual impairments how to get around. But the question right now, as we head into 2025, is should occupational therapists be allowed to teach some of the skills that we also teach? It's a big controversy within our field, and so if you are watching this and you don't really understand, stay tuned, you probably will. But if you are an orientation and mobility specialist or even an occupational therapist and you're looking for a little bit more of an understanding, a broader picture, that is what you're going to get today. Now, I guarantee that I'm going to piss some people off, and if that is you, absolutely, I welcome your comments down below. If you like what I have to say, also leave a comment down below. I will circle back around and chit chat with you, and I really want to dive into a few things today. For one, I want to dive into what does that document even suggest. I went ahead and read it, and we're gonna dive into that. Then we're also gonna dive into what are the common fears that people are experiencing as O&M specialists when we're looking at bringing other people in to support our role as well. And then 3, let's also look at the facts here, okay? So the first thing that we want to dive into is what does that document even say? You know, there have been talks within the Facebook group about, do you like this? Are you okay with this? Yada, yada. And then one person pointed out, hey, you guys, this doesn't even concern us. Occupational therapists, as it relates to ACVREP in this moment in time, the accreditation that's being opened is not at all for school age orientation and mobility specialists. It's only for adults. So what do we know about working with adults? Well, we know a few things, and I'll get to that. But first, within this, what are they going to have to do? Are occupational therapists going to just be able to come in and take over? One of the big fears that I've heard a lot is that occupational therapists already feel like they know what they're doing with people with visual impairments, and obviously they don't because we are the experts, right? Okay, well, what I've gathered about occupational therapy and their certifications is that there's a generalist degree that you get out of school, and then once you get your feet wet, then you can go into various other actual tracks that give you a little bit of a leverage within your profession, but it makes it so that you are then an expert in that one specific area. We do this a lot within orientation and mobility, but we don't have specific certifications for them, where occupational therapy is a bigger profession and they have certifications for them. One of these certifications is going to be the certification within ACVREP. Now, granted, as I'm filming this, the certification program is only open for comment review or public comment and review. Then the SME committee is going to be taking all of this information and then making a final decision. I fully anticipate us to see in 2025 ACVREP make that decision, and I fully expect them to move forward with it. And I'll tell you why that in a minute. So occupational therapists have a generalist degree, and then they go into different tracks. Now, some people might go into a track of working with students with multiple impairments. Some people might go into a track of working with traumatic brain injury. Some people might go into sensory impairments. There's so many tracks that I don't fully understand because the profession is so big. Now, we're just looking at one track with one age range of people. let's talk about what they're going to need to do. They are going to need to have a mentorship. They are going to need to be able to pass the exam, and they are going to need professional development and training in that area. It specifically says those things on that document. So for us to say that they're just going to come on in, swoop in and take over and they're not going to have any training is not necessarily true. Now, are we going to have to build this training? Yes. But that's not a problem. We can build trainings for people. We build trainings for ourselves all the time. We can build trainings for others. We have these skills, we have this understanding, we have this knowledge of how to work with people with visual impairments. What we don't have are enough orientation and mobility specialists to actually do that job. So when we're looking at occupational therapists coming in, let's dive into the fears now, right? The fears that we have around this are that they're just going to come in, they're going to dismantle our profession. They're going to make it so that orientation and mobility is obsolete. There's a big scarcity fear that we have. And when we feel scarcity, when we feel fear, we want to buckle down. We want to hold on to everything that we have and say, no, this is ours. Just like a 2-year-old in their classroom says, no, these blocks are mine. But the all-knowing teacher who's been around a little bit longer can come around and say, actually, it's better if we share. Why is it better when we share? Because when we work in silos, we get a lot less done. Orientation and mobility in and of itself has siloed itself. We've siloed ourselves into, I only work with students. I only work with students with multiple impairments. I only work with guide dogs. I only work with adults. I only work with certain populations. And oftentimes we don't even connect. We don't collaborate nearly as much as we need to in order to have a broader perspective. We learned from the pandemic and from 2020 on, if you weren't already co-teaching, that co-teaching is the way to go if you want your learners to have a more holistic view and a holistic education. And so when we look at our fears of, are they going to take over? It's a valid fear because, yeah, they're probably going to take some of our learners. And that means that we are going to be in a position where we are going to have to elevate what we are doing. So the old way of saying this is how we've always done things is no longer going to work. As I was doing research for this, it was impossible to find how many adults in the United States are receiving orientation and mobility services. But what we do know, just anecdotally, is that most orientation and mobility specialists are on a wait list. And that means most adults have to wait 3, 5, 6+ months in order to receive services after they've done all the paperwork, after they've been accepted into the system, after all of that stuff has gone through and they finally get an O&M specialist, they still have to wait. And that isn't any fault of the person with the visual impairment. That has to do with the system. And it has to do with the fact that in the United States, there are 3,037 active orientation and mobility specialists. I'm going to say that again. There are 3,037 active orientation and mobility specialists. So what do we know about the aging population? Well, my friends, it is not going down anytime soon. We do know that currently there are millions of people with visual impairments who are older individuals. In fact, in 2020, there were 39 million blind adults. 39 million in 2020. Now, that also was 237 million adults who had a severe visual impairment. That's kind of a lot. But by 2040, we're going up to 80 million blind adults and then 451 million people who have a severe visual impairment who are adults. Now, I don't know about you, but that's quite a bit. And anecdotally, if we can look at just think about like Golden Girls, right? Golden Girls, 65, that age range back then. they weren't working very much. Maybe they would have been in the OIB population. But now, same 64, 65-year-olds, they're the new Sex in the City. Those are the women that we are treating. Those women are still going to work. They're still wanting to do things. They're still wanting to be active. And we're seeing more people enroll in orientation and mobility services as adults. So it only makes sense for occupational therapists, of which there are 144,000 certified occupational therapists in the United States, to our 3,000. They can take on more of that role. Now, what is it going to mean for us? Two things here. For one, as O&M specialists, we're going to have to get better at co-teaching. We're going to have to get better at our leadership skills. And you might have also read the AER documents where they're looking at OMAs, occupational orientation and mobility assistants. Right. When we look at that document, it specifically states that out of the 120 orientation and mobility specialists that were trained to be able to teach an OMA, like to train the trainer, right? Only 12 of them did it. What that tells me is that there's a huge hole in this bucket of leadership within orientation and mobility. And it makes sense because we have a lot of students, we have a lot going on, and a lot of us are really stressed out about it. So of course, we're not really able to lift up our heads and look around because we're still struggling with our current caseloads. Now, what we have in the United States all around is, picture the United States, right? We have very few orientation and mobility specialists. But once you become an O&M specialist, it can be difficult to then move to a different place because they may not have a job open. Or vice versa. There could be so many jobs open and not enough O&M specialists to fill those holes, even in highly desired areas. I live in a great city, and if I leave my students, there's no other O&M specialist to take them. And I constantly have to say, no, my caseload is full, and that's unfortunate to those students. Okay, so one of the other fears that's also very valid is adults first, children next, right? And maybe that is what's going to happen. Maybe ACVREP is looking at it and saying, actually, it would be great to have OTs who are already certified and already in the schools to become certified within ACVREP. Because here's the thing, our big fear is that they're already doing it. Well, they're already doing it. So let's teach them, let's help them. Because here are the statistics within the school age setting. I've cited these many times before. There was a study done in 2022 by the American Community Survey, and it stated that there were 600,000 people, students age, with visual impairments. 600,000, that's a lot, to our 3,037 active O&M specialists. Okay, now APH has a study also that in 2021 or 2022 said that there were 55,711 students who are legally blind. So do that math, that's still over 18 legally blind students per orientation and mobility specialist. Now, if we think about where medicine is going, we're not getting less students with visual impairments. We are now saving babies even before viability. One of my students currently was born before 24 weeks. That's before they're supposed to be alive at all. And we're going younger, we're getting more disabilities, and cortical cerebral visual impairments is becoming even more prevalent. And I have some other thoughts on that. We'll talk more about that at another time. But as you can see, orientation and mobility specialists are in need of support. occupational therapists are already in the schools, they're already in that setting, they're already commissioned by the vocational rehabilitation services. Why not allow occupational therapists to provide the basic skills, the traveling within the home, the general lower level skills that all of our learners need, and that we know they are not generalizing, because we still only spend 1% of our learners' waking lives with them. So if we know all of these facts, we can choose to sit in our fears and say, nope, these are our students. This is what's going to happen. I have to protect my job. Your job isn't going anywhere. Your job is very prevalent. Your job might change. It might grow. It might go into a new environment, but that's okay. Because as orientation and mobility specialists, we know we didn't get into this to do the same thing every day. We came into it because we are people who are innovative. We're hopping into a career, a profession that we are building from the ground up. No other profession right now has to do that. We still aren't even in the big government directory of professions that exist. Like, we are a baby profession. And we might be struggling right now, but that's just because we keep disbanding ourselves. If we can come together, if we can lean into innovation, and if we can increase our leadership skills, we don't lose. Like, you guys, we don't lose. There's no replacing us. There's no losing here. There's only winning. So I say professionally, and I'm putting this out to the world, that I welcome all orientation and mobility specialists to extend our hand to the occupational therapists, and even as AER develops their systems, to training OMAs. And I think as long as we can continue to be inclusive and we can continue to be forward thinking, we will continue to win. Now, I do have some thoughts that I will share at another time about how to do that, but we'll save that video for later. All right, you guys, I hope you have a great rest of your day. Please like this video, subscribe, leave a comment. We have incredible things coming down the pipe for you in 2025, including a rebrand that I alluded to a little bit earlier. And I cannot wait to see you at any of our programs.